Welcome to Public Health Ideas. My name is Sandro Galea. I serve as Dean of the School of Public Health here at WashU. Today I have the privilege of speaking with Professor Sarah Moreland-Russell, a professor at the Washington University Brown School of Social Work. We're going to be talking about her paper in implementation science, action planning for building public health program sustainability, results from a group randomized trial. Sarah, let's start with why the work. Where did this work come from?
Sure. So the story actually starts almost 20 years ago. When I started to be interested in the concept of sustainability, I was working on a project with Doug Luke that was funded by the Centers for Disease Control, Office for Smoking and Health, to evaluate the implementation of the best practices for tobacco control programs. And at that time, around 2002, 2006, tobacco control funding across the United States was severely cut. All states suffered about a third of funding at the time. And so CDC really wanted us to evaluate whether best practices were continuing, were programs implementing effective activities to sort of continue to work on tobacco control. And so we sort of dove into this evaluation, thinking that we weren't going to find much happening. And in some states, that was true. Programming was severely limited. But in other states, there were actually, as usual, or more programming going on. And we were really wondering why this was occurring. Why were some states who had still been suffering funding cuts still performing as usual? And so we wanted to dig a little bit deeper. And so fast forward a little bit, we began working on developing the program sustainability framework and the program sustainability assessment tool. And while these were really useful in sort of defining sustainability and outlining the concept or the what of sustainability, they really didn't sort of provide the usefulness or the tools or the how to build capacity for sustainability for the practitioners. And so I really became interested in developing a training and testing a training that would provide that how and really build the capacity for sustainability among tobacco control programs.
Let's talk about the word sustainability. You used it a lot. It's in the title of the paper.
Yeah.
What do we mean by sustainability here?
So very academically based or technically based, sustainability is the presence of adaptive structures and processes that enable a program to implement evidence-based activities over time. To sort of break that down into something that states could conceptualize or actually work on, or programs, we developed the program sustainability framework, and that organized these adaptive structures and processes into 8 main domains, which included organizational capacity, program evaluation, program adaptation, communications, partnerships, strategic planning, environmental support, and other environmental support.
Tell us a little bit about the curricula. So you call them this program sustainability action planning model and training curricula. So what is that? How did you develop this curricula?
Yeah, so to begin this process of this research, we really dove into the literature and consulted with training experts. And what we kept seeing in the literature and hearing from experts is that you really need to develop a action-oriented, collaborative type training model. And so we used Kolb's experiential learning sort of as our basis for developing the training, and developed an in-person, action-oriented training that really involved going into states for 2 days and spending some time with them. Specifically, we first taught them about program sustainability and the concepts of sustainability, and then we dove into discussions and exercises that helped states sort of conceptualize where they were in regards to building their capacity for sustainability. Then we set forth to really help them define and outline a program sustainability plan that they would implement over 3 years. The most important concept or component, I think, of this training model when we were developing it is the fact that it was collaborative in nature. We really involved every stakeholder that participated in the comprehensive tobacco control program. And in tobacco control, that's a significant number of partners. There's a variety of different types of activities that are part of the comprehensive tobacco control programs, anywhere from organizational operations all the way to sort of advocacy and policy development that public health departments can't themselves take on. And so it's really important to sort of involve those stakeholders and include sort of their perspectives on developing a sustainability plan so that they can move more effectively toward building their capacity for sustainability and really garnering that buy-in and acceptance of responsibility to actually implement and do the things that they outline.
So you prefaced my next question. So you focused on tobacco control programs. Yes. Why those programs?
So two main reasons for tobacco control. As I stated, I think previously, tobacco control programs are notoriously sort of at risk of funding cuts. And more practically, we focused on tobacco control programs because the CDC Office for Smoking and Health actually required the programs to develop a sustainability plan as part of a requirement for federal funding of their programs.
In a few sentences, what question did you set out to answer? What did you find?
Yeah, so in this group randomized trial, we involved 23 state programs, and really, so we involved 12 control and 11 that participated in interventions. We really wanted to understand whether or not this training program increased capacity for sustainability in the intervention states.
And we also wanted to sort of look at if dosage mattered, how much time we spent with the states, how much technical assistance we provided also had an effect. And finally, we wanted to look at whether states that were doing really well on policy progress were more accepting or performed better after the training compared to lower policy performing states. And so we really wanted to compare those two and understand the differences between those two once the training was sort of initiated and the outcomes of sustainability as they relate to that. And what do you think were the key takeaways?
So the key takeaways were, first and most important, that the training was found to be effective in building capacity for sustainability, regardless of the amount of dosage or the time spent with states. And second, we found that actually the lower performing or lower policy progress states actually increase their capacity for sustainability more than higher performing states. And this makes sense, but I think is an important finding because in public health, we often face sort of limitations in our resources, and we're sort of trying to prioritize funding. And so I think prioritizing training and funding and resources for lower performing states would be the best use of resources.
Funding. It's easy to blame everything on funding. Can you talk a little bit about how important funding is for sustainability, which in some respects is obvious, but where funding fits in with the full range of other factors?
Yeah, so in our study, that was something that we actually looked at and specifically used the percentage of CDC recommended funding in each state, how much they were actually implementing. And you had those who were implementing a high percentage and those that were implementing a lower percentage. And we basically found no difference in the capacity for sustainability in the intervention states in high and low percentage funding states. And so that just goes to show that funding, while it's important to sort of get a program up and running and to implement activities, it's not the only component or factor, and other factors are important to sort of consider when you're planning for sustainability.
Let's talk about schools of public health for a second. So what role could academic schools of public health play in developing, disseminating best practices that contribute to sustainable public health programs?
So First and foremost, I don't think we talk about sustainability enough in the classroom. It would be very simple, I think, to add to a program evaluation or program implementation course. And I say this because, when you go out into the field of public health, whether you're in a state health department or a local organization doing public health work, not many have ever even heard of sustainability. And so I think implementing that into public health education would be, one of the first things to do. And talking about the importance of sustainability to public health, that, not only implementation, but sustaining public health programs over time ultimately is how we see the most benefit and improve health outcomes.
Now, when work like this gets published and read, of course, it's several years after you had the original idea and you wrote the paper. So a few years later, what stays with you? What do you think are the key actionable steps as one thinks about creating sustainability in public health programs?
Sure. So implementation of newly funded programs does not guarantee long-term sustainment. Research has documented that I think it's almost 40% of even effectively implemented programs stop or risk failure after 2 years of losing funding. And so it's really important to include program sustainability planning as part of an operational process. Similar to sort of as strategic planning has sort of become an operational process, and programs engage in that regularly. I think that sustainability planning, that needs to happen also. And funders need to require sustainability planning, similar to how CDC OSH, or Office of Smoking and Health, has sort of required this as part of their funding. I think other funders should consider making this a requirement so that programs are thinking about this up front rather than at the end when they're at risk of losing funding. The other sort of main takeaway that I think about often is involving the system in sustainability planning. I really do think that was part of the success of the training, was involving a variety of stakeholders for buy-in and sort of implementation of the sustainability plan. As we talk about in systems science, tobacco, and especially in tobacco control and in a variety of different public health programs, the system is vast. And so involving them into program planning, I think is most effective and really proved to be effective in sustainability, in building capacity for sustainability. And then finally, just that other research, I think there's that sustainability is still in its infancy in the area of implementation science and in developing research in regards to sustainability. I think that the concept of sustainability has grown in literature, but the actual tools and trainings and the how of sustainability has not been developed in the literature as much or in science. And so I think that future work could be done to sort of increase our understanding and knowledge and capacity for practitioners to build their capacity for sustainability.
This is interesting and important work. Thank you for doing this.
Thank you.
And thank you for joining the conversation.